Dr. Diez, why don't you tell us what is the difference, if there is a difference, of veneers and lumineers? And what are each one or both of them used for? What advantage do they have? What do they do to people? Can you tell us about that?
Sure. Well, let me start with Lumineers. Lumineers, the best way I can describe it is you're just taking a piece of porcelain and putting it on top of a tooth.
A clip-on tooth nail.
Exactly. The problem with that is if you have a tooth that's already sticking out too far, which is a more common problem than teeth pushed in, you can't add a piece without making it stick out even further. The other thing is if you're only adding to a tooth, they're going to feel fatter and thicker to your tongue, and a lot of times they look bulkier. Very hard to correct more severely crooked teeth with Lumineers. Now, that being said, if a patient has fairly straight teeth in a decent position, but they have spaces between their teeth, that's a nice case for Lumineers because you can be very conservative. You don't really have to alter the natural tooth very much, and you can bond these veneers, the Lumineers, these thin pieces of porcelain to the teeth, and end up with a nice aesthetic result.
Because they're so thin that you don't need to grind the tooth down. You just can glue them over. Right. However, no matter how thin they are, the tooth becomes a little thicker. So
it's still going to be thicker, and to a trained eye, they're going to be a little bulkier.
Kind of a stone on the Santa Monica beach.
I'll be the first thing. I'm not a huge fan of Lumineers only because the cases they really look nice on are so few, far between. Okay. Most of the patients that I see who are unhappy with their smiles have teeth that are either rotated or pushed way out. There's fairly large discrepancies. That cannot be corrected with Lumineers. A lot of patients are dissatisfied with the color of, not just the position, but the color of their teeth. It's nice that you can keep the material thin and be very conservative with the tooth, but if you truly want to change color of a tooth, sometimes you have to have a little bit more porcelain, a little bit thicker veneer going on the tooth. And to do that and still keep the tooth a natural dimension and contour, so not only does it look right, but it feels right to the patient's lips and tongue, you do have to remove a little bit more tooth structure. Keep in mind, we're talking fractions of millimeters here, okay? The veneers we do maybe are a millimeter thick. Lumineers, they're half millimeter thick. Sometimes they are millimeter thick. So we're talking fractions of millimeters here. But aesthetically, there's no comparison in my book and in my dental world to veneers versus Lumineers in 95% of the cases. So we just get much better aesthetics with true veneers.
Well, that I guess, at least in your practice, will most people will get, in this case, the veneer. And it looks like, for the patient, both of them are clip-on tooth nails, really. But one, you need to grind the tooth a little down, which probably means you need an injection or so. Where on the other one, you might not need one. Am I right there?
Sometimes, but sometimes. But again, the best example I can give you is if you have a tooth that's either sticking out or rotated where part of it's sticking out. How do you correct that with a Lumineer?
No, I understand. I'm just saying in terms of if a Lumineer would potentially apply, the only difference to the patient is he might not need an injection. And that's correct. Kind of and really injections these days don't hurt anymore and the whole thing. Right. And yes, grinding down the tooth is something you try to avoid. For that much, probably, if a person really wants to not grind down his tooth, because, there is a little risk and a little, kind of, why do we do that involved, he probably should go for Invisaligns.
You took the words out of my mouth. Exactly. So for people who have really, really crooked teeth, or even moderately crooked teeth, but they don't like the idea of having to remove any enamel, they're not going to be a good candidate for Lumineers because Lumineers can't correct that. Invisalign is the perfect alternative.
Mm-hmm. And for the other ones, be it the chip, the this, the that, the discolored, the name it, the slightly, or the guy who says, I would love overall my braces or my Invisalign, but 6 months, 7 months, 9 months, whatever.
Right.
Let's just get rid of it this afternoon. And let's walk out here with a perfect smile. A little grinding of my tooth doesn't really matter. I already have 2 crowns in the back. I seem to have survived it well. Let's go for it, right?
Yeah, that's absolutely. A lot of patients want it immediately.
I would be one of those guys. Even though.
And you know what? And so would I. And that's my personality too. Yeah. Something else to consider. A lot of people, they come in and the teeth are either naturally unattractive. I mean, not everybody is born with a nice shaped tooth or nice shaped teeth. Okay, you can treat that with Invisalign all you want, and you can make ugly shaped teeth straight, but they're still going to be unattractively shaped teeth.
Right.
In those cases, I'll tell a patient, I'll say, look, I can make it straight, but I can't correct the shape of the tooth. Only veneers can do that. So, and in other cases, a lot of times people come to us and they have all kind of fillings, discolored fillings that are broken down, teeth that have already been cut on. And in that case, you've already lost that conservatism, if that's a word, okay, of not having to cut into the tooth. In that case, I'm not sure there's a huge advantage to straightening the teeth and then having to replace the fillings every 5 to 7 years to make them look good. Veneer the teeth, and when you veneer them, it's a long-term restoration that can straighten and restore the tooth at the same time.
Right. Good. Well, anyway, a Lumineer is kind of like a veneer, except it's made by one company who came up with a slightly different method of doing it, and that's really the only difference for us. Now, let me ask you, is there a major difference in price, one or the other?
They're the same price, basically. It depends where you are in the country. They're the same price. And keep in mind, everything I do, I call a veneer, but a lot of our veneers, okay, in those instances that we talked about, are the same thickness as a Lumineer.
Right.
It's no different.
Right. Because I'm sure that technology is getting better too.
Oh, already. My God.
Yeah.
Yes. But like you said, there's a company out there who's kind of taken off with this thin piece of porcelain, and they put a name on it. But there's a lot of doctors doing thin veneers, just very similar to Lumineers. They just don't call them Lumineers.
Right. Well, I've noticed that there's a lots of us patients out there who, they go Veneers, Lumineers, and they don't know what you just explained at all for all purpose. It's like a total different animal, but it really isn't. In the end,
it really isn't.
Kind of like things. Well, all right. Again, so veneers do give a bunch of veneers, 4, 6, 8 in the front. They really can transform a person's smile, look, and everything completely. Am I right there? I mean, utterly.
Yeah, it's incredible. I used to give seminars, and I would show pictures to my crowd to show the pictures before and after. And it is amazing. It doesn't just change the smile. You can truly change someone's face. It's hard to explain without showing the pictures, but it truly can change someone's entire facial expressions. I'm talking about the eyes and everything when they smile.
Right,
So.
because you can brighten them, smaller them, lengthen them, shorten them. You can do you can do literally anything you want. You can have more rounded, less rounded. You can do literally can do what you want.
You can fill the lips out. You can fill the cheek. There's it's an endless amount of things that you can do.
You can match the color more to whatever you kind of want. All those type of things, right? Beautiful.
That's right.
Well, all right. And if you want them all done, you go under sedation dentistry in your office, and you walk in at 12, and at 5 o'clock you're ready to go. At 7 o'clock you have your dinner.
That's right. That's exactly right.
Dinner date.
Dinner date. There you go.
All right. Bye bye.
Bye bye.